We're finding children who had difficulty around 15 and 16 years of age, significant difficulties, has backed up to 4 and 5-year-olds. So we have to work with these children, and 3-year-olds are a really difficult population. Most people think it's the teenagers. It's the 3 and 4-year-olds that are very difficult. And we have to get them turned around early. Earlier the better. Children were having more and more difficulties with behaviors and emotional functioning as well as learning, but there weren't any programs addressing that effectively, and not a lot of programs. I decided to go out on my own. That way I could develop my own programs, and South Charleston seemed to be a good location because where we are, we're right off the interstate. It's a nice little community. They're very supportive of their business people, so that's why I located in South Charleston. The first office is our outpatient therapy program. This is your typical therapy where you come once a week, once every 2 weeks. We do our assessments there, and we have therapists there. We have licensed counselors, psychologists. We also have nurse practitioners for medication management and a psychiatrist. And so it's your typical maybe coming once a week, once every 2 weeks. Our other building, which is our intensive program, it's an 8-week program from 8 to 4:30, 5 days a week. It's much more intensive. And so the children do get their academics there, so they're not losing any credits. But we have group therapy, individual therapy, plus parent training. So we do evaluations if necessary, but we start with an extensive interview where we get information from birthing history on up to present day, social history, academics, emotional functioning, behaviors. And then we decided we have to do a complete evaluation to see where they're functioning at, their level of functioning, so we know what interventions to use. We'll use usually an intelligence test and an achievement test. We want to see if those correlate with each other to see if there's a learning disorder. We want to see what level they're functioning at. If they're low functioning, we're going to be more behavioral in our therapy and intervention, not so much, when I say cognitive, it's going to be more of a black and white stimulus response type thing, not a reasoning thing. So, and then once we decide what is needed, we use different therapy techniques to help the child turn around, especially with emotional difficulties. Now with behavior difficulties, we become more concrete, more structured, and we develop behavior plans. We educate the parents on how to manage the children to, in a sense, rehabilitate them or retrain them so that they can function well in different settings such as home and school. A lot of times we talk about natural logical consequences. If you misbehave, this is what's going to happen. If you want to be able to use your computer, play with your toys, watch TV, use the phone, you have to follow the rules at home. And one of the things that has been misleading children actually is that they feel that this is their house and they have a say in what goes on. That's not correct. This is mom and dad's house. It's the family's home, but the rules are set by the adults, and in order to get what you want, you must follow the rules of the house. And that's what we teach the parents, and that's what we teach the child. If you want this, this is what you have to do. Stimulus response. You behave, you get a reward. You don't behave, you don't get the reward. For the parents that are having difficulty with what we're providing for them, there are places that have in-home therapy, but sometimes it's not so consistent. But we're trying to teach them, and we want them, sometimes we have to bring their children into our intensive program so that the child understands what they need to do to be successful, because we're very structured here. And so it helps turn the child around so that the interventions we're teaching the parents will work more effectively, because the child is understanding what's needed, and also the parent. In our practice, we do have just about every service necessary for mental health. We have the medication, we have therapy, we have evaluations, plus our intensive program, which is unique. It's been around for 20 years, It's helped kids get back into school, stay out of trouble. We're not always successful, but we have about a 75 to 80% success rate. If you're having difficulties with your child, be sure and just call our office. They will set you up with an intake interview so we can decide what type of services are needed and what the difficulties that your child is experiencing. And that way it's an informative interview. It doesn't commit you to anything, but at least you can find out what's available, and we will also talk about what may be going on with your child.